Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, May 9th, 2020. COVID update. We've had a little bit of technical difficulties the last few days between the speaker, and then we did a high resolution, and then that took 5 hours to download, and I had a screw up in it in terms of something, and we wanted to edit it out. We couldn't, so sorry about that. So anyway, statistics. 4 million people infected, documented, about 280,000 dead in the world. 1.3 million in the United States, 280,000 dead in the United States, about 4,500 in Oklahoma, about 263 or 4. And I'm not belittling that. It's just the numbers, again, as I tell you, blur. The big thing with the numbers is it's very steady state, 23,500 yesterday new cases. So we're going to be running about 25,000 new cases a day. And running 1,500 to 2,000 deaths. Might drop to 1,200, might go to 2,000, could hit 3,000 if the government statistics are right. So we're kind of going like this right now. We're not really, the total case number's going up, but we're kind of leveling in terms of the total number of active cases in the United States at one time. And hopefully it will stay like that for the next week or two, and maybe we'll get lucky and it will go down. But we're going to talk about that because there's some countries that opened up a little bit who've done outstanding, and we're going to go over what happened to them and the concerns that we may need to be ready for here, because we can utilize some very smart people in other countries who've thought this through and tried to open and see what happens and apply it to our situation. Little update on just life and what's happening with COVID. For those of you who continue to think that hospitals made a ton of money, I think Mercy Hospital System, Mercy Health out of St. Louis, which has hospitals throughout Missouri, Oklahoma, and I believe Tennessee, if I recall correctly, had a big announcement about furloughing multiple thousands of patients this upcoming Monday, including physicians, nurses, MAs. They're going to close multiple clinics down, consolidate, do a lot of things like that. So that's is a sad thing for those people who've worked there and for their patients who may not have access to them anymore, because when a clinic gets shut or a doctor gets furloughed from Mercy, it's not like she can just go out and hang a shingle in a week. It's a 4 to 5 month process. Sometimes 6, because you have to get new insurance contracts and do all this stuff. So it's a nightmare for the physician, who will be incredibly stressed. Their patients will have to change. And so you're going to have to see what happens. Now, the busy doctors in Oklahoma City in the Mercy system are going to be fine. If someone happens to be slow, or they're a PA who's slow, they're going to be at risk for getting cut. But we'll just keep our fingers crossed for all the people in the Mercy system and pray for them and pray for the patients. And there'll be some delays in care. This is reality. There'll be delays in care for the Mercy folks who want to see their primary care doctor, and all of a sudden that primary care doctor has to absorb a couple different practices. But again, they're going to be motivated. They care. They're nice folks. But financial realities are financial realities. When you've lost all your elective surgery, or 92 or 93% of it for 2 months, and you have to pay all the bills and pay all these people, and it's a tough thing. Mercy also is cutting their administrative staff and executive staff massively with furloughs. All the remaining administrators are going to take a 26% pay cut, so it's not like the clinical staff's getting hammered, not the executive staff or administrative staff. Everybody's getting hurt. Same thing is they're spreading the pain. They're not. It's very even. They're not going to give anyone a 401k match this year. So again, these are huge moments. There's 1.4 million healthcare workers who've been furloughed as of last week. It's probably going to hit 1.6 to 2 million in the next month. So just a huge impact on our healthcare system in a negative way from COVID. So just remember, no one's making money on COVID. Okay. Now, maybe the lab companies who are selling these antibody tests that are a total waste of time and charging $100, they're making a crap ton of money on this, but only because people are doing them who shouldn't. And so you just have to keep that in mind. Now, I understand doctors who order them on patients who are being pressured so much by the patient that I had it, and I want to prove that I had it. And so the doctor finally goes, sure, I'll get it to show you didn't. But other than that, it's a gigantic waste of time, because true negatives are probably true, but if you're a positive antibody, it's probably unlikely to be true. There's a lot of false positives. So let's now transition to forward thinking. I was out today. It was beautiful, gorgeous. Rode my bike partially around the lake with my wife. It was just beautiful. A lot of people out today. Went to lunch with a friend, Larry Smith, had a wonderful lunch. Came into a restaurant. Everyone had their masks on. I had my mask on. They had hand sanitizer after I opened the door right away, because it's transitions, remember, in and out of places and bathrooms. And then I went to the table. Larry and I elbowed, and then we had lunch. Then when I left, I hit the hand sanitizer as I left, pushed the door open with my back, went to my car, have hand sanitizer, used it again, and ran some errands and came home wearing my mask, using hand sanitizer. And so that's what I think we need to get used to. And I think that's a successful technique for most people. Masks matter. 2 reasons. 1, primary. If you're infected and you don't even know it because you're asymptomatic, if you have a mask on, you're breathing into the mask, the droplets just don't get out and spread up to 20 feet if you cough or sneeze. So that's primo. And then secondarily, there's a blockage effect. I have a KN95 mask, which isn't as good as the N95 mask, but it's a really good mask, and it is very protective. And so even when I was using a lesser mask, or if I'm just when I'm riding my bike, have a buff on like this, that impedes transmission to me. It may not be perfect, but it again is extremely helpful. And it's, when you look at everything, when anyone says a mask doesn't matter, it's not going to do anything for you. They don't understand numbers. Again, if you can shift, let's say, 5% down on infection because of wearing masks, when there's 300 million people in the country, it could be 15 million people. It doesn't mean, in the perfect world, masks would be, we'd have 100% reduction. That isn't how it works. But you got to look at it, it's a pattern. Everything's patterns, which people don't understand, the pattern of behavior. So if you're washing your hands, using hand sanitizer, keeping further away from people, not getting close to people, you have a mask on, you're taking your vitamins, you're building a layer of protection in all different ways. And then you don't have to worry about getting sick. And let's illustrate that with what happened in South Korea and Germany. So those countries have done the best. South Korea's knocked it out of the park. They had around 8,000 cases by week 3. They got it under control. They ended up with 215 deaths and only peaked out at about, 10,100 cases roughly. And they were going to be the epicenter. But what they did is they universally socially distanced because they have a homogeneous society, so they can take governmental direction, unlike us, because we're all too smart for ourselves. And then they didn't do shelter in place. That was mandatory. They stayed away from each other. They wore their masks. They washed their hands. They tested, and then isolated people. And so they brought it under control. So what did they do about a week and a half ago? They said, okay, we've really killed it. We've done well. And we're going to start opening stuff. So they did. And one of the things they opened about a week and a half ago was bars. And they have some other kind of kooky bar stuff that I don't totally understand, but just think bars. And so lo and behold, they had a pulse this week. Well, what do bars, their people are packed in. And so they're socializing. Why do you go to a bar when you're in your 20s and early 30s? It's to meet someone to be interested in. And so if you meet someone you're interested in, or you're looking, you may start flirting, you get close to the person. And you're doing that a lot, and all of a sudden one guy who ended up being infected, they think exposed more than 2,000 people. So again, close spaces, problem. Let's jump to Germany. Germany's done great, kick butt, again, low death rate. Some of that is reporting, but ultimately they brought it under control really well. Started opening up businesses and things, some bar stuff. what happened. So meatpacking plants, just like what's happened here, they're all next to each other in a conveyor line. 180 workers at a meatpacking plant were positive this week by the end of the week. So again, they're very close together. So we have bars, maybe a meat market, we have meatpacking plants, and you have all these people close together. So again, it emphasizes why spreading things out, wearing masks, washing our hands matter. So as we move forward, if you're a business owner, what do you have to think about? Well, I got to spread people out. I got to have my entrances sanitized and my exits. I got to have, if I have bathrooms, I got to have those sanitized. Sanitizing bathrooms is not easy, because all of us, when we have that job, I've had that job as a locker room attendant back in the day, which provides incredible focus on moving forward in your life. When I was in high school, cleaning toilets and stuff is not the funnest job in the world. And, having someone do that all day long somewhere is not easy. So you just have to realize that bathrooms and entryways are not great. And then you pack people in. Oh, so it turns into a disaster. So when you're a business owner, you got to start thinking about this stuff moving forward. And so that's what I would encourage everyone to do. And strategizing for business is something we'll start talking more and more about. So we need to learn what went wrong in Germany and Korea and apply it to ourselves. And so it'll be interesting to see what happens with our caseloads in Oklahoma over the next 2 weeks. But I still would be very optimistic about everything. If you're taking your vitamins, you're going to be fabulous. I will eventually comment on the Kawasaki syndrome with children. Very concerning. Again, it's about, per infections, it's about 1 per 100,000 or so if you're reading about it. So you don't want to get mentally overwhelmed. I think the killer wasp issue is much greater than that. But there's going to be some one-off disease events with COVID-19 that are going to kill people. And you just have to know it's like being hit with a bolt of lightning. So you don't want to, again, be that person who goes, COVID's nothing. Well, the bolt of lightning's going to hit people in every state and every community over the next 3 years. So always be considerate and kind about COVID. So have a wonderful day or evening. Sorry, we're having some technical difficulties. Have a wonderful Mother's Day. Kim, have a wonderful Mother's Day. She should, because I've already given her flowers, and we're going to have a nice brunch at a Mexican restaurant. So anyway, take care, and I'll have another one tomorrow. Good night.